Hi friends, I am Dr. P.K. Hazra from AMRI Hospital, Dhakuria. On International Stroke Day, I want to convey certain message to you for better quality of life and prevention of stroke. And if you have a stroke, how can you get rid of the consequences of stroke? এই স্ট্রোক ডেতে অনেক কিছু নতুন তথ্য নতুন আবিষ্কার হয়েছে and we will highlight one by one. Stroke is a devastating disease and it is caused mainly by hypertension, diabetes, smoking, cholesterol, and many times it comes from the heart. So whatever treatment is available for the heart, equally applicable for the stroke. Time is very important. Time is muscle, and also time is also the brain, equally applicable. So once you have a heart attack, you have to reach to the hospital at earliest. Similarly, if you have a stroke, you have to reach to the hospital at earliest period of time. The medicine which was discovered for the heart, like thrombolytic therapy or clot buster, are usually effective for the stroke patient if you have a clot inside the brain. Many times, this brain cannot tolerate any forms of stroke, whether it is clot or hemorrhage. Hypertension can cause hemorrhage. A fall can cause hemorrhage inside the brain, and these are preventable to large extent. So control your blood pressure, take modern medicines of diabetes, which can prevent stroke, can prevent heart attack and heart failure, which is completely different from what used to practice 5 years ago. The set of medicine has completely changed, which can prevent both your brain and the heart, also your legs and kidneys. Smoking alcohol, definitely nobody indulges if somebody has a history of stroke in their family. Now, unfortunately, some strokes are very large and can cause paralysis of your body. And these are usually clot related. So what as a cardiologist we do, we take them to the CT scan. If there is no hemorrhage, then we take them to the rescue machine, that is cardiac cath lab and angiography. Through micropuncture, without opening the brain like a surgeon, we remove the clots from the heart. That is called embolectomy. The same stent which are used for the heart, also used for the removal of the clot or establishment of the blood flow in the brain. There are certain situations like atrial fibrillations where there is a clot formation inside the heart, and many times there is a medicine called anticoagulant, newer anticoagulant, which are given, which can prevent a further stroke. Those who cannot take these anticoagulant, which can cause hemorrhage in your gut, in your urinary tract, they are candidate for LA closure device. So LA closure device is done by the cardiologist, and we are a pioneer institute and kind of a center of excellence for this device in the whole country. AMRI Dhakuria has taught many people how to treat this stroke by putting a device inside your heart that is called LA closure. And these are the device which remains there permanently inside the heart like a pacemaker, which can prevent the migration of the stroke, the material of stroke, the embolus from the heart chamber to the brain. It is one-time therapy and lifetime guarantee that you are not going to take this medicine ever in your life, and these clots are not going to form inside that chamber, or if it forms, it cannot move from the heart to the brain. So the cardiology practice, the catheter, the wires, the balloon, the stent, the medicine which are applicable for heart attack, equally applicable for neurogenic stroke. So you work as a team with the neurologist, radiologist, cardiologist, and these are a team game nowadays. As I mentioned, the risk factors, the drugs, works in tandem, like aspirin, clopidogrel, these are the drugs, the newer drugs, or a cholesterol-lowering vaccines. The cholesterol-lowering agents also prevent strokes in the long term. The stroke should be given a priority in all community practice. And on International Stroke Day, our aim and objective is to reduce the burden of stroke in the society, which can be done by early detections, regular health checkup, blood pressure control with modern drugs, sugar control with newer drugs, weight control by newer drugs, lipid lowering by drugs, combinations or vaccines, genetic testing, physical exercise, and other modalities. So I wish you a great festival and a great festivity. Wish you Dasera and happy Durga Puja. Wish you happy Diwali in advance. Stay fit, walk, reduce your stress, live a healthy life, sleep well, and control your numbers. High blood pressure number, high sugar number, high A1C number, etc. And you can definitely live longer with early diagnosis, early treatment, and early rehabilitations of stroke. So stroke is no more a threat to the society. Many people who has come to this hospital has gone back home with complete recovery, without any paralysis, without any loss of speech, loss of memory, or loss of cognitive function. That means the brain is still intact, but it has to be done within few hours of onset of stroke. So time is muscle and time is brain.